Hey everybody, Dr. Sharma here. Just want to give you an update on our practice and our response to the COVID-19 epidemic that's dramatically gripped our city. Indeed, the way this epidemic is spreading and how fast it's spreading has dramatically changed the way we've got to interact with our friends and families, our coworkers, and to that end, our patients. We want to maintain a safe social distance and want to maintain the idea of trying to flatten the curve. But in our practice, we want to make sure we're taking care of you, especially those that have had recent surgery. If you're a patient that has had surgery with us, we definitely want to see you. We want to make sure you're healing well, make sure your sutures can come out in a timely fashion. We want to make sure that your questions are answered and give you the best possible outcome we can. If you're an established patient and have had surgery perhaps in the last 3 months, we may not ask you to come back into your scheduled visit. However, we might be able to see you in a virtual consult manner. A virtual consult is a way that we can have a face-to-face conversation but via video, and it's a radical new way of interacting with our patients, and I think it's actually going to be an interesting model going forward. The virtual consult allows us to have a direct face-to-face consultation. It'll allow you to ask us questions. It'll even allow us to do a virtual physical examination. For instance, if you're a patient of mine who's had a tendon injury, I can see how your function is just by you showing me how your fingers are moving. If you're a patient that's had a recent breast surgery, in the comfort of your own home and in an environment that's going to be considered a medical environment, both with a chaperone and my nurse in the background, we'll be able to evaluate your breast incisions, your wounds, see how you're healing, and answer your questions that you might have. And so for new patients, we definitely want to see you, but it may not necessarily be in a face-to-face manner. In fact, given the environment we currently are with the COVID-19 virus, it might be better that we try to set up a virtual consultation, and that essentially means that we will establish a direct video link with you in a secure manner. Realize that it's going to be done in a professional setting. That is, I'm going to open up a chart, I'm going to create a physician encounter, and if we're going to be talking about cosmetic surgery and performing any kind of direct visual examination, we will have my nurse involved so that we will have what we call a virtual chaperone. I think doing this will give you the opportunity to answer questions or have us answer questions